Hello, I'm Dina Dukovic, and this is my population level health education intervention presentation. Population level means we will address social determinants of health, which are upstream, socioeconomic, political, and cultural factors that have been shown to increase the likelihood of various health problems in disadvantaged groups. The setting for the health education intervention is Perris, California. 4 health-related issues were identified. These were nutrition, lack of usual primary care physician, lack of health insurance, and difficulty in obtaining health care on a timely basis. Healthy People 2020 is a program established by the Department of Health and Human Services that has the goal of reducing health disparities based on social determinants of health. Evidence-based research is the basis for identifying issues and establishing specific time-related goals for improvement. The 4 health-related issues were addressed in Healthy People 2020, along with social factors that increase the incidence of health problems in disadvantaged groups. Poverty is a determinant that is related to health issues across a very broad range, and it is often mediated by other factors, such as low levels of health literacy, and low levels of perceived self-efficacy. Educational interventions are designed to increase health knowledge, as well as to encourage healthy behavior, such as increasing the overall intake of vegetables in the diet or establishing a relationship with the primary care physician. Next. The methodology for establishing goals varies with the type of issue. With some issues, such as health insurance, the goal is that 100% of the population be covered. This goal was addressed on a national level by the Affordable Care Act. Other goals are established as a 10% reduction or increase, as the case may be, of the disparity related to the health issue. That's the case with the issue of delay in obtaining health care. The goal is a 10% reduction from baseline levels. Health issues identified in Healthy People 2020 are grouped in broad categories, which have a number of subcategories. These categories include nutrition, access to health services, educational level, violence and crime, tobacco use, alcohol and other drugs, environmental issues, and others. The goals for the 4 health issues addressed by this educational intervention are shown in green. Next. Different areas and different populations have their own specific issues, which are the most important to address based on the severity of the disparity, as well as the potential for improvement. This is not a one-size-fits-all situation. The physician or nurse cannot prescribe proper treatment without having first established a diagnosis. A diagnosis is determined based on history, physical examination, and laboratory tests. Similarly, the nurse educator or public health nurse cannot design an appropriate intervention without first having established a community diagnosis as to what are the most important issues in that community. The community diagnosis is based on a needs assessment, and just as the nurse must lay hands on the patient in the physical exam, the nurse who would address community health must actually go there, lay hands on the community in a sense by making careful observations, interviewing key people in the community, and doing further research as suggested by observation and interviews. Every community is different, just as every patient is a unique individual. I was fortunate in this case that the city of Perris has a strong and visionary mayor who was pleased to discuss community health issues and who related several initiatives completed or underway specifically addressing public health. Individuals such as Mayor Vargas may be powerful, helpful partners in addressing community health issues, just like a multidisciplinary collaboration, a provider addresses an individual patient's health issues. Having established a population health diagnosis, the question is, what is the appropriate treatment or intervention? There are numerous theories of health knowledge, health behavior, and level of self-efficacy. And some are better suited in particular populations and particular social determinants than others. In the early days of educational interventions, there were often good educational programs designed according to a sound theoretical basis that had limited effectiveness because they were not designed according to the results of a community-specific assessment. The precede-proceed model is not a health education or behavioral theory. It is a logic model which provides a framework for integrating community assessment and intervention design. Slide 9. The key aspects of the precede-proceed model are that the members of the community are actively recruited to participate not only in the assessment phase, which is comprehensive, but also in the design of the educational intervention. The members of the community are thus empowered, and their participation in the design of the intervention is truly powerful. It's truly a powerful component of the intervention itself, in that it provides a great boost to perceived self-efficacy. The other key component of the model is monitoring of the outcome and adjustment of the intervention as needed. Next. Slide 10. Heart failure is a syndrome with many specific etiologies. Similarly, there are numerous different etiological connections between social determinants of health and increased prevalence of a disease. The design of an intervention addresses the specific barriers present in that community, and a theoretical basis in actual plan of action is informed by these barriers. Factors such as health literacy, cultural issues such as language barriers, poverty, lifestyle factors, and lack of perceived self-efficacy guide the specific details of the intervention. Proper choice of the specific components of an intervention, combined with monitoring the outcome for adjustment if needed, leads to the most effective outcomes. Next. There is good news with the bad, and it is important to recognize the assets present in the community as well as the barriers. In the case of Perris, there are several major assets. These include a dynamic mayor, a $100,000 grant from Washington, which is in place for 30 satellite community gardens, a new 24-hour urgent mental health care center, and a new city ordinance requiring fast food restaurants to first offer water as a beverage with children's meals, and new jobs legislation. The specific interventions are educational for the most part. It is easy to forget to address the simple things first, and simply making people aware of available but underutilized resources may go a long way in addressing health disparities. The nutritional educational intervention, for example, is focused on the goal of increasing the amount and variety of vegetables in the diet. We are all familiar with barriers such as available variety in grocery stores, propensity for spoilage when cooking for one, and having to buy more than you need. Preponderances of fast food establishments and low levels of health literacy so that health benefits are not appreciated. There are others in Perris. Excuse me. In Perris, the educational intervention is tremendously reinforced by the fact that there's already a $100,000 grant from Washington in place for 30 satellite community gardens. This is the stuff of which health educator dreams are made. As education is reinforced by the sense of community and the perceived and real boost to self-efficacy that comes from active participation in the community garden. We mentioned before that there are many theories of health knowledge and health behavior that may guide the specific design of the intervention. The precede-proceed framework allows the nurse educator to use those interventional techniques that are best in tune with the population health problem. Details in the assessment of a patient in heart failure certainly determines the optimum mix of preload reduction, afterload reduction, inotropic support, and chronotropic support for that particular patient. Similarly, details in the assessment of the health of a community are used to determine the optimum types of intervention for that particular community. Next. These issues are real. They exist in Perris, California now. For some of us, these are our neighbors. Just as clinical medicine has to come to terms with skyrocketing costs and the ethics of resource allocation, so must the public health nurse face the reality of costs and scarce resources. Healthy People 2020 offers specific goals for each issue. These generally take the form of a % reduction or a % increase from a baseline value. Sometimes the goal is 100% presence of a condition, such as having health insurance or a certain percentage of an established recommendation as in the nutritional intervention. Next. The fact that 3 of the 4 issues identified in Perris had to do with access to healthcare is not surprising. We know social determinants may be thought of as upstream risk factors for traditional risk factors, but factors such as not being able to obtain medical care obviously are very important to address. Good goals are constructed by use of the SMART algorithm, which stands for SMART: measurable, achievable, relevant, and time-specific. The long-term goals may examine factors further downstream, such as disease prevalence, while shorter-term goals address prevalence of the social determinant itself and any mediating risk factors. To summarize, Perris, California was identified as a disadvantaged low-income area. More detailed assessment, including personal observation and interview with Mayor Vargas and demographic research, allowed me to identify 4 common health issues. 4 community health issues. Using the precede-proceed model, educational interventions were designed. These were done with input from community members and taking full advantage of new resources in the area. That completes my presentation. Thank you for listening and happy holidays.